When Joseph was 3 years old, he had, again, a few years of really good medical stability in my mind. He was in preschool, doing really well in school, and right around 3 years old, he had a few incidents at home that just seemed uncomfortable to me. He would be running around, seemed out of breath. I think there's our classic episode that he was running up the stairs, and then he didn't lose consciousness going up the stairs, but something definitely funny happened and changed with that. And a lot of these episodes just kept on adding up, and we had an appointment with our primary cardiologist at the time, and he thought it was time to go the next step and to actually do a cardiac catheterization on him to take a look where things were going. After that was done, there was actually a lot of question about what was going on, and I think the severity of his case, it looked more severe that they got in and really got a good look at his heart. And he suggested at first that we transfer partial care over to the heart transplant, heart failure team. And I think it was kind of phrased, we would continue to see him every other appointment, and then Dr. Blume the other appointments, and kind of ease us into it. And we began that with a hospital stay when Joseph was 3. And I think it was purposely picked when you were on service. So we got to, we were going to play around with some meds, add some meds, try to make some medical management changes. And really, I think the goal was to get to know you and to build that comfort level to transfer services from someone that we had dealt with for 2 of Joseph's 3 years over to someone else, and to build that trust and comfort.
No parent wants to hear that, and no parent truthfully wants to meet me. So you're starting from there, and I think the most effective way is to actually just acknowledge that and say, at first, tell me what you heard about why you're meeting me, just so you know where to start, because some pediatric cardiologists say nothing. They say, oh, I want you to meet Dr. Blume. And other pediatric cardiologists say, you're going to meet the heart failure team. Many cardiologists change the name to heart function team, and we're going to make the function better because they can't even say heart failure. So understanding what the family understands, and then just saying it out loud. Your cardiologist is worried that your child's heart in the next 2 years is going to get really sick and that he might die, and he's asking us for opinions about medical and surgical treatments. And I think just putting that out there so they're not trying to guess what you're thinking is the most important piece.
What you left out is you also jumped on the bed and started wrestling with my 3-year-old, and we're just... So yeah, I think it's the delivery of hard news and also being honest and upfront, but also having the skill and the care for the family and the patients to let them trust you. And by the interaction with, it's one thing I remember from the moment the most is just the interaction you had with my son. And there was that early trust that just built from watching you not just come in and talk about him as a patient, and this is the medical condition, this is it, but playing with him and talking to him and with him and about him and taking the time to get to know him as a person.
I think that's so hard sometimes in a busy ICU and a busy ward when you're running patient to patient, and you have to check your boxes from the physician side of meeting this new family and getting all the information. And in fact, the most critical piece is that first interaction. And you actually don't need to get any information across on that. You actually have to start the relationship. And I think starting with the child is the most, and that child is the center of that new team. And what I often say to families is, we're not changing your team, we're just expanding and adding to your team, because your previous cardiologist knows you really well and knows your child from when he was a baby. You don't want to push them away, and parents won't tolerate that anyway, and I wouldn't want that I want that expertise of the other cardiologists too. And so having that transition time, we often will alternate visits but again, I say we're expanding the team, not changing the team. And I think that that's a big relief for a lot of families as well.